You're listening to the Public Health Epidemiology Careers Podcast, episode 139.
Welcome to the Public Health Epidemiology Careers Podcast, where we explore public health epidemiology careers and share tips and strategies to help you enter or transition into the field. And now, your host, Dr. Charlotte Hughes Huntley.
Greetings, everyone, and thank you for joining me on this episode. In this episode, you'll meet Miss Sandra Coker, a soon-to-be emergency medicine physician with a heart for public health, and the founder of Black Girl, White Coat. There are so many great lessons in this episode, including an excellent example of the power of professional networking and branding on social media. Now, Miss Sandra Coker is an emergency medicine physician in training, set to begin her career in the summer of 2020. Born and raised in Houston, Texas, one of the most diverse cities in the country, she found herself immersed in multicultural communities from an early age. Now, this upbringing, partnered with her passion to serve the underserved, led her to pursue her dreams of becoming an emergency medicine physician with specific focus on diversity and inclusion and social medicine. Sandra is also the founder of Black Girl, White Coat, and that is a social media initiative dedicated to providing motivation, mentorship, scholarship, and representation for students traditionally underrepresented in various fields of healthcare. Now, Match Day is March 20th. It represents the day when the National Resident Matching Program releases results to applicants regarding the location assignment of their residency and fellowship training positions in the U.S. Now, we recorded the interview before March 20th, but this episode is being published after March 20th. So I want you to listen to the very end of this episode because I will share an update. I'm actually going to share the results of Match Day with you so that you can find out about Sandra's residency assignment. So we talked about that quite a bit during our interview. She was kind of hanging on, waiting for that to happen. And so I thought it'd be kind of neat to provide that update for you at the end of the episode. So I will connect the interview with Sandra right after this special announcement. Are you curious about public health consulting? Have you ever wondered what it's like? What do they do? How do consultants get started? Learn what it's like to be a public health consultant by attending the Expo. The Expo is an online event where a select panel of public health consultants and entrepreneurs who are passionate about the needs they address and the populations they serve come together and share their businesses. Attending the Expo is very affordable and convenient because it's available online. Learn about public health consulting from public health consultants who do it every day. Visit drchuntley.com and click on the Expo tab from the main menu to register and attend the Expo. Well, today I'm excited to introduce you guys to my special guest, Ms. Sandra Coker. Sandra, welcome to the podcast.
Thank you so much. I'm so happy to be here. It's an honor to be invited by you. So yes, I look forward to this.
Yes, I'm excited too because I follow your hashtag on Instagram.
Thank you.
And then I started to, I think there was something you tweeted on Twitter that really caught my attention. And then I was like, I've got to talk to her. And that's where that started. So we're going to jump in. And I'd like to start by you just telling the audience about your background. Introduce yourself in your own words and just tell us a little bit about yourself and then we'll kind of go on from there.
Yeah. Okay. So my name is Sandra, of course, like you already said. Born and raised in Houston, Texas. Played basketball growing up. I was very athletic, but I pretty much knew I wanted to be a physician from a very young age. So after high school, I put the basketball down and decided to go full force on the pre-med track and just do everything I can to, increase my chances of achieving this dream of mine. So I went to Baylor University in Waco, Texas, not too far away from Houston here. And I got my undergrad degree, a Bachelor of Science in Psychology, while on the pre-med track at Baylor. And then that prepared me for medical school, which I'm now completing, set to graduate in just a couple months, which is kind of crazy. and I will be going into emergency medicine as my specialty of choice. So it's been a long journey, and there's been a lot of, hiccups and road bumps along the way, but I'm so grateful to say that I'm finally almost at the end of my academic journey, at least. And yeah, walking into my career in a couple months.
That is exciting. Oh my
Yes.
goodness. Oh my goodness, that's exciting. I remember I have an older brother who's a medical doctor, and I do remember when he got to that point, how it was such a big deal. I remember when I got to that point, a couple of months of crossing that final stage crossing. It's a huge deal. It's very exciting.
Oh my gosh, so exciting. So I've never been so eager, so like nervous, but also excited at the same time. It's crazy.
That's always a good sign. That means amazing things are just around that bundle of emotion.
Yes, I'm excited. I'm very eager.
Oh, that's awesome. So, when did you first become interested in, and this is really, you're in healthcare, you're a medical doctor, but I know a little bit more about your passion and interest, and I think of it as more encompassing of public health. So,
Yes.
please, when did you first become interested in this, and just kind of describe how it really interconnects with public health?
So something was birthed when I thought of Black Girl White Coat. At the time, I wasn't sure of what exactly it was, but what I did know was that there was a disconnect, a gap between access to healthcare and education for African American or students of color, period, that I wanted to be able to fill. I felt like when I got into medical school, your fate is pretty much sealed, unless you do something drastic to, mess up that journey. You're pretty much going to become a doctor once you get that acceptance. So when I started Black Girl White Coat at the beginning of my med school career, I knew I needed to do something, and I knew I wanted to do something. I knew I was called and put here in this position to give back and to help close that gap that I mentioned. During my first year, towards the end, I had kind of a panic moment where I felt like I needed a mentor. I hadn't had a solid mentor, and I knew the importance of mentorship, but I hadn't had a solid mentor up to that point. Long story short, I reached out to Dr. Mandy Hill, who is an academic chair in our Department of Emergency Medicine here at McGovern Medical School. And very quickly, she became my mentor and my the one to teach me about research and bring me in on projects. Dr. Hill is very passionate about sexual health education. She's very passionate about African American women and the health disparities they face, the health challenges that they face, and really just all the sexual health, HIV, STI burden that African Americans are just faced with, especially in the South. So that's what a lot of her research focuses on. She has a master's in public health. She's a PhD, and she's a chair of departments here at McGovern. And so linking up with her, I was able to put my desire to do something more, to fill in a gap, to address disparities, to address, inequalities and inequities. I was able to pair that with the research that she already had going. And together we just clicked from the beginning. And since then, I've been doing work tied in with social media and Black or White Coat, tying that in with addressing sexual health education for African American women who are burdened with the increased diagnosis of HIV and sexually transmitted infections. So that's kind of how that came about. And since then, it's been the springboard for everything else in my career and in my academic career as well.
That's awesome. Yeah, that's really powerful to have a mentor, to have that type of impact early on, in your medical school journey and that pivotal part of your career.
Yes.
What about, I'm going to shift a little bit here. As you think about the work or your experiences leading up to this point, how do you think that the previous roles really help prepare you for transition into, where you are now, where you're a couple of months from now, where you be, just how do you think, those previous experiences and roles help you transition?
So between Baylor University and medical school, I did have a gap year where I worked as a medical scribe in an emergency department. And that was my first exposure to the how do I say this? The difference in treatment that a patient could receive based on their skin color. That was my first exposure to the world of disparities in that realm, in the physician-patient relationship realm. And that was very eye-opening for me. It was very emotional for me. And then Black Girl, White Coat was formed. And then I really narrowed in on emergency medicine as my specialty. And I chose it because it offers you a unique ability to reach people of all demographics, of every walk of life. So in the emergency room, you know that we cannot turn away any patient. So a patient who is of lower socioeconomic status, low education, maybe homeless or battling with addiction or whatever it may be, can come in and receive the same treatment, or has the right to receive the same treatment, the same attention, the same resources as an insured, older, prominent, wealthy person coming in the emergency department as well. So I liked that the emergency room and this specialty offered me that opportunity to deal with all kinds of patients. And my desire and my passion to tackle these healthcare disparities, to give our people resources that they need to educate on, their health and their healthcare decision making, that really just all combined together in medical school pretty early on, thankfully. And it shaped my desires and my passions, and just me going forward toward this emergency medicine specialty. Because there's many instances where I considered something else. I considered, doing things that wouldn't put me in such close contact with patients. But at the end of the day, I know that what part of my work is, what part of my calling is, to address these inequities and these disparities. And I feel like the best way for me to do that is the emergency room setting. So it all works together. And I feel like I'm really excited to have that opportunity to be that person for my patients.
Amazing. That's great. I love it. Definitely being really clear and really in tune with, your passion. That's going to drive you. That is definitely going to keep you moving day by day, going to work, getting up and doing it again. Have you thought about where you want to go, where you want to work, what type of hospital setting, cities, rural, large, small?
So we actually have match day coming up on March 20th, which is where we find out where we're going to be headed for our residency program, which is pretty much our first big job. So that's pretty exciting, coming up here in a few weeks. But as far as the kind of place that I applied to and the kind of places that I interviewed at, definitely wanted it to be a large city where there would be a county hospital feel, where I knew I would be taking care of all types of patients, where I wouldn't only just get one side of patient care. I wouldn't just, be exposed to the insured kind of patient or the wealthy kind of patient, but I wanted to make sure that I had a diversity, that I could take care of those patients and, walk through those issues with those patients, but then also be exposed to patients who are uninsured, who may have no other primary care provider, and they use the emergency room as their primary care stop, who are coming from maybe areas where there are no hospitals, in a 10, 15-mile radius, and the emergency room is really the only thing that they have, in the city that I'm in. So I did target and specifically apply to hospitals that had a county program feel, but also had the backing of an academic institution, so that I can continue my research and continue to, use the resources that these academic institutions provide for physicians and, social emergency medicine needs.
Oh, that's great. I was actually kind of thinking that before I asked the question, I was thinking, yeah, that's probably where she'd like to be. Mm-hmm. So that's good. Now I'm sitting here thinking now, and this is going to be at the time this episode comes out, it will be after, now we're recording, in advance. So by the time it publishes, it will be after March 20th.
Oh my gosh.
So if people are listening, but what I want you to do is, I'll probably add a note to the show notes page. So you guys, I'll tell you about all that at the end of the episode here. But when you find out, because I remember watching this on social media, and I love all the videos, from Match Day, and all the videos and the pictures when people find out where they're going. So you have to tag me
Oh,
on
definitely.
social media when you find out. Instagram and Twitter, tag me so that I know, because I'm going to be anxious to find out too.
Definitely, definitely. You will be you're coming along the journey with me.
That's right. That's exciting because I definitely will look forward to updates. We'll have to bring you back a few years into the future there and talk about, what you've done and what it was like and get updates. I think that'd be great.
Of course, of course.
So I'm going to ask you about a little bit more specifically about Black Girl, White Coat. Can you kind of describe, the purpose, who do you serve? And also another question added on to that is, because I understand it's something you started when you first started medical school. What is your plan for that, when you're a doctor and you're beyond medical school? So tell me about that.
Yeah, so Black Girl White Coat is basically a social media platform or initiative that I started when I did begin medical school. And the purpose is to fill in that gap, like I mentioned earlier, to be the person, the resource, the mentor that I needed when I was going through this whole process from high school and undergrad and navigating my gap year and navigating applications. I needed somebody to help me out through that. And unfortunately, I didn't have anybody that I could really turn to. So it was a lot of me, looking for information and gathering information by myself, which is doable. But I feel like we can help other people. So it's just me making sure that I extend a hand to anyone else who needs it. So the purpose of Black Girl White Coat is to provide motivation, representation, mentorship, and scholarship to underrepresented minority students anywhere along their journey who are looking to pursue careers in healthcare. So this can be people who are wanting to be nurses, nurse practitioners, physical therapists, occupational therapists, physician, dentists, and so on and so forth. We know, studies show it's very clear and it's easily accessible knowledge to us now that there is a need for diversity in healthcare. We know that our patients do better when they are taken care of by a diverse team of practitioners. So I feel like there's a need here and there's a place for me to, fall in line and do what I can to help out. So that's really what Black Girl White Coat is. We are currently, for the future, as far as the future, you asked about what's to come next as I do end out my medical school career and go on to be a physician. I'm going to continue with Black Girl White Coat. It's only growing and it's only, gaining more support and more attention, which I'm super grateful for. So I'm going to take it on to the nonprofit status. I'm going to take it on to organization status where I can have more opportunities to supply students with more scholarships. I'm going to widen my mentorship program. I'm going to offer more free resources to students. So there's only more that I can do and only more that I want to do. So I'm really excited. The trajectory in which we're growing right now is only positive. So I hope to really expand it into the nonprofit sector and just to garner more financial support for students who are in need.
That's great. I'm really happy to hear that. And that's exciting. That's an important step because when you sort of discover the need, it served a great purpose for you through medical school. And it'd be really hard to just kind of say, okay, I don't need that anymore and walk away. But you're finding the way to continue to serve. And I like that.
Definitely. The goal was never to walk away. I never thought that I would walk away. I never, envisioned walking away. It was always supposed to grow and just mean more and encompass more and be able to do more for other people. So the fact that I actually have that opportunity now, there's no way I'm letting it go.
Yeah, absolutely. Well, I'm loving this conversation. This is great. And I want to shift just a little bit and ask you a couple of more questions. My audience is a large portion of the people who listen to this podcast are students, current students of public health. They may be undergraduate students or they may be working on their master's degree in public health, which means they could have any other combination of degrees. They could be medical doctors working on their master's degree in public health. They could be nurses working on their master's degree in public health, or any combination. So
Yeah.
if they're current students who are interested in, a public health career, what kind of advice would you have for someone like that?
My number one advice is definitely mentorship. there's no way around. Like I said, I didn't have a proper mentor until ending my first year of medical school. And that was kind of late in the game. I do wish I had a mentor earlier. I think a lot of things would have been different, but I was able to finish and get through, even though I had a mentorship relationship later in the game. But my best advice for a student going down the MPH, the public health route right now, is to find somebody who has been where you want to go, or who is where you want to go, who has accomplished what you want to accomplish, and just form a relationship with them, establish a relationship with them, and just take heed to their advice and really just seek out their advice and their knowledge, and let them tell you about their personal experiences, their personal failures, their successes, and let them just help you with a blueprint, with a roadmap, with ideas. And there's so much that comes out of this mentor-mentee relationship that is so invaluable. I can't really explain it, but I can only offer my life as an example of how things changed as soon as I met Dr. Hill, my mentor. As soon as she began to pour into me, doors began to open. I was more knowledgeable about, research topics. I was more knowledgeable about public health. I was more knowledgeable about ways I can use my degree as a physician, as an MD, to help the public health sector to tackle and talk about and address disparities in healthcare. It was only with her help, with her knowledge and her wisdom, that I was able to get to the place that I am today. So definitely my number one advice would be to find a mentor in the field that you want to go into, doing the things that you are aspiring to do, and just really just sit and soak in all their knowledge and wisdom. And yeah, I think that's the best advice I could give.
That's excellent advice. And I agree with you on that. And, I have another portion of my audience who have already completed their degree, but they're having trouble getting into the field, or maybe trying to transition into the field that they want to be in. And it sounds like that same tip would apply. Do you have anything differently, or anything to add to that?
And I definitely think the same tip would apply, because the people before you have had the same struggles, or maybe similar struggles, as far as, entering the job field, the workforce, or taking ownership of, a sector of this big public health field or whatever. So definitely a mentorship and an advisor, an advocate who sits at big tables, who sits in these big places and has the ability to mention your name, has the ability to open doors for you, has the ability to create opportunities where you can't create them yourself. That's what these relationships really do. So I think the same advice applies. And then also I would push for social media. Unfortunately, I know a lot of us do not like social media. I myself, even though I created a social media platform, sometimes I wish I didn't have to use it. But what we know is that in 2020 and years beyond, social media is only going to gain, a larger presence and importance in the lives of the people coming up, and in the lives of organizations and companies and everything. So if you are able to create a presence for yourself on social media, whether it be, it should be professional, a professional presence for yourself on social media, I think that'll go a long way, because you'll be reaching people that, you wouldn't necessarily think about instinctively or initially. And opportunities definitely will arise from that. I've had doors open for me just because of social media, because Dr. Huntley, you saw a tweet of mine.
Yeah, that's right.
You saw a tweet of mine and now I'm here. So it's things like that you don't really see happening. You don't really expect it, but social media will just bring the unexpected right to your door.
That's perfect. And that's a great example. You're absolutely right. Absolutely. I won't even try to say anything other than I agree with you. Great advice. Thank you so much for taking the time and coming on the podcast and sharing your story and being such inspiration. What you're doing is important. As you and I were chatting before we started the podcast recording, I have a daughter who is in college. She's a junior in college, and I've mentioned her a few times on the podcast. And I know that it is just being from the mother's perspective, and then also from my colleagues, and just from my own personal perspective, representation matters. But yes. I just know that now, like you mentioned with the social media, the importance, being able to connect. A lot of people are going to social media to identify with people that can, align with what they're interested in or help get some answers and to just feel like they belong. And it matters when you can share your passion and be representative. You saw a need, you saw something that was missing, and you just wanted to do your part to represent and to encourage others to follow their dreams. And that is, kudos to you. I admire you for doing that. And I encourage you to continue to do that. It is just so important.
Thank you. I really appreciate the opportunity to share a little bit of my story and my background on your podcast. And I really hope I was able to help somebody or inspire somebody out there. If anybody has any questions, I'd be more than willing to keep on talking about my story and about my journey with anyone who asks.
That's awesome. Well, in just a moment, I'm going to let everyone know how they can connect with you because you were very generous in sharing connection information on social media and website and all that. So I'm going to share that and tell everyone how they can find that in just a moment. But I just wanted to thank you for being here. I look forward to following with you and just watching you grow and all the amazing things that you're going to do in the years to come.
Thank you.
All right. I'll be in touch with you again soon. Well, I really hope you enjoyed that interview as much as I did. Sandra was such a delight, and I'm so excited to follow her journey as she continues forward. I was able to join her live on match day with her family and some close friends as she received the notification of where she would be assigned for her residency. It was very exciting and emotional at the same time, and I felt honored to share that special moment with her. I'm pleased to update you and let you know that Sandra was matched with her top choice and is preparing to move to Chicago for her emergency medicine residency. If you would like to connect with Sandra, soon to be Dr. Coker, officially, then I encourage you to do so. You'll find links to connect with her from the show notes page of this episode, which is episode 139. So just go to drchuntley.com, click on the podcast tab from the main menu, and then navigate to episode 139. You can also click on the Expo tab from the main menu, and you'll find more about the Public Health Consulting and Entrepreneurship Expo. All right, everyone. Until next time, have a fantastic rest of your day.
Thank you for listening to the Public Health Epidemiology Careers Podcast at drchuntley.com.